Thanks, Eric. So Kevin gave me this title to use, Non-Operative Management of the Rotator Cuff, Is It Legal? And not only is it legal, I'm hoping to demonstrate to you that it may be ethical. And these are my disclosures. They're not typical. I don't have any industry relationships, but I am a surgeon, and I really do like fixing rotator cuff tears. This is me when I was young. Kevin and I were fellows together in Vail, Colorado. You can see Kevin up there as well. It's a long time ago. But when I was young, I was told that the presence of a rotator cuff tear required surgery. If a patient came into the office and had a cuff tear, that bought him a ticket to the OR. We treated it like an open tibia fracture. The presence of the condition was the indication for surgery. Why did we think that way? Well, I trained with Hawk. Hawk trained with Neer. Neer got information from Codman. And that's just how medicine was practiced. And we call that eminence-based medicine, and that's led to a lot of different things in the history of medicine, like bloodletting, trephination, frontal lobotomy, and the guy who actually invented frontal lobotomy won the Nobel Prize, and of course thermal capsulorrhaphy, which we really don't use much. What we were supposed to do is use data instead of dogma. And you may ask why I'm using red and blue colors in my slides. Well, if you take the blue pill, the story ends. You wake up in your bed and believe whatever you want to believe. But if you take the red pill, and I show you how deep the rabbit hole goes, remember, all I'm offering is the truth, nothing more. So let's talk about data, the red pill. I'm going to talk about prevalence, symptoms, rehabilitation, and why patients have surgery. First of all, how many rotator cuff tears are out there? Well, the U.S. population in 2010, at the last census, there was 308 million Americans. Over the age of 60, there are 57 million Americans. How many of those people have rotator cuff tears? Well, this was a systematic review looking at all the cadaver studies, the MRI studies, the ultrasound studies of both symptomatic and asymptomatic patients, and there was a range of full-thickness rotator cuff tears, but the minimum was 10% and the maximum was 40%, and this is patients over 60. So how many cuff tears are there in the United States? Well, if you do the math, that means there's between 5.7 and 22.8 million cuff tears in the United States. At minimum, it's 5.7 million. And you'd say, oh, that's awesome. I'm a surgeon. I'll be busy for the rest of my life. Well, how many of these people have surgery? Well, in the United States, we do 270,000 cuff surgeries per year. And if you do the math, it's somewhere between 1.2 and 4.7% of people with cuff tears are getting surgery. So wait a minute. If less than 5% of the people with cuff tears are having surgery, should I be operating on every cuff tear that I see? All right, let's make an assumption. This assumption that we make is the subjective findings that we see on the patient presents with, pain, can't sleep at night, limited function, are related to the objective findings that we see on the MRI. We're surgeons, we fix broken anatomy, we make the assumption that the broken anatomy is responsible for their symptoms. Is it possible that this assumption is wrong? Well, first of all, as I just mentioned, we know that there's about 95% of the people with cuff tears who are not getting surgery. Are these cuff tears painful? Well, probably not painful enough to be in your office. Do symptoms correlate with cuff tear severity? We know if we have mild arthritis, we'll have mild symptoms. If we have severe arthritis, we'll have more severe symptoms. So we looked at this with our Moon cohort, and we found that pain level, duration of symptoms, and activity level did not correlate with rotator cuff tear severity. What about failed cuff repairs? We know in the literature that about a third of cuff repairs we do fail, but the patient satisfaction, pain, patient-reported outcome scores seem to be the same if your cuff tear fails or if it doesn't. The only thing that's different is strength. If the cuff tear heals, you have better strength. But if the cuff tear was a source of pain, shouldn't these patients be hurting? The relationship between pain and rotator cuff disease is not robust. The subjective findings are not closely related to the objective findings, and the cuff may not be the source of this patient's pain. Is rehab effective? Well, therapy certainly doesn't fix the tear. If the cuff tear was a source of pain, therapy should fail. This is our Moon study. We had 452 patients that we put through an evidence-based physical therapy program. Anywhere along the way, they could drop out and have surgery. This is our 5-year data. It's not published yet, but we just analyzed it not too long ago. We have 85% follow-up at 5 years. 3 patients died, 16% were lost to follow-up, 24% of the patients had surgery, 76% did not. Statistically, you're more likely to die than get a reverse arthroplasty if you treat your rotator cuff tear non-operatively. Well, what things lead to surgery? Well, we looked at all these different things, and things that did not predict surgery were structural factors. So the anatomy of the rotator cuff really didn't have anything to do with it. The patient's pain level, the duration of symptoms did not. What did predict surgery? Patient expectations. If a patient believed therapy would work, it would. If a patient believed therapy would not work, they dropped out and had surgery. And as Gandhi elaborated, your beliefs ultimately lead to your destiny. This is the relative strength of the predictors, and this is an interesting graph. So you can look at all these different features that might predict who has surgery. By far and away, the patient expectations drove this. So again, if a patient thought therapy would work, it would. So here's your thinking points. First, more than 95% of cuff tears are not having surgery. Second, the cuff tear may not be the source of this patient's pain. Third, if you do rehabilitation, 75% of the patients do well even at 5 years, and you're more likely to die than have a reverse arthroplasty. And finally, why some patients have surgery? Because they believe it, or worse, we talked them into it. So, non-operative management of the rotator cuff, is it legal? Of course it's legal. The real question is it ethical to do surgery when more than 95% of the people with this condition are fine and not in your office, when a third of your surgeries fail, and this does not seem to affect the outcome? The anatomy that you fix is not related to the patient's symptoms, and the decision to have surgery is driven by patient expectations, not the anatomy. Is it legal to do surgery without informed consent? Well, if Kevin was in my office, I'd say, Dr. Plancher, you have an atraumatic tear like 6 million other Americans. Less than 5% of those people have surgery. If your symptom is pain, exercise therapy will get 80% of patients better. It may take 12 weeks and it will last at least 5 years. If your symptom is weakness, you should consider having surgery. Surgery improves pain and weakness, but the repair I do will fail a third of the time. If you elect to treat this with exercise, you can contact me if your symptoms worsen. We can monitor your cuff tear to see if it's going to progress or not, though it's hard to predict how rapidly it will progress, if it will progress, or to what level of symptoms, because the data between pain and the cuff disease is not very clear. Remember, all I'm offering is the truth. Thank you.